Some of the opportunities that residents have to get involved in the community are almost endless. However, we do want to highlight a couple of them. I want to preface the following by saying that we are going to be in COVID times and many of these things might be altered. But these are historically what we've been involved in, and hopefully we can continue to have residents engaged. The number one thing, which is actually in our curriculum, is our community medicine rotation. This is by far one of the best ways to initially, as an intern, to get involved. You have the ability to work with Homeboys Industries, which is a phenomenal organization. Here we are taught how to remove tattoos, and the compassion, the patience, is such an amazing experience. One of the few times in medicine that I actually felt like I was changing someone's lives. The other part that is an experience that I'll never forget was going to our MAT clinic, our medication assisted treatment for opioid use disorders. This is in downtown Los Angeles. It is run by a couple of our fellow graduates, and it's interesting to see how this clinic kind of runs as an urgent care / ER for people that are truly suffering from opioid addiction. Also, under this community medicine rotation, you have the ability to rotate through Venice Clinic's homeless outreach. This is housed through Venice Clinic, and with an attending, you are going to where people live. You are going to Venice Beach, you are going to the Santa Monica, you are going to Malibu, and you're meeting the patients where they are at. By far very rewarding. We also have a public health rotation. Additionally, in our curriculum, you can also be a part of the Summer Urban Health Fellowship. This is a mentoring program. It includes high school students, it includes college students, medical students, and residents, in addition to our attendings. And they do a 6-week fellowship program where they really look at medicine through the lens of social determinants of health. Through this Summer Urban Health Fellowship, we are also able to engage through health talks with community partners. And then things that are not necessarily as tied into our curriculum, but are heavily dependent, and a lot of it done by leadership through residents, are the following, such as our free clinic that we have. This is located in Torrance, run in conjunction with pre-medical students from UCLA. We also, through the leadership of our own residents, developed clinics in Tijuana under now the name Refugee Health Alliance. You can see some of their board members are actually our most recent graduates. We try to go twice a year to Tecate, where we have a long-standing relationship with the community and try to deliver care in 2 zones. One of it's an urban, the other one is a more rural area. The demographics definitely are different. The urban one's much more adults, and then the rural one is much more pediatrics, and a little bit of women's health. We also have a connection, and we've done water droppings. This is through Border Angels, where we go out to the desert and we leave water for the people that are crossing the border. We have a strong connection and a relationship with Physicians for Social Responsibility and Physicians for Human Rights. Under Physicians for Human Rights, we are doing training for how to document appropriately and support asylees through our residency program and our local union. We have the opportunity to be heavily involved with the local, the state, and national politics. And if that is something that you're interested in, there's definitely space for you to be involved. And then something that we look at, environmental justice, food deserts, food swamps. Harbor UCLA is a home for a food pharmacy, meaning that we have the ability to help our patients by delivering them nutritious food. It was once housed in the hospital, but now at times of COVID, this has really been taken off as a food pickup, and this is run by our residents as well.